Good afternoon, everyone. I hope you had a lovely lunch and you're ready for part 2. So I just want to take a few minutes before we move into our next session to extend my personal thanks to my staff, Sonia Mertz and Ibun Wilborn, for all their help in organizing today. Give them a round of applause. I'd also like to express our gratitude to Evans Stark Designs for their work in making us look good. Our new logo, our conference logo, and all the redesign of our resources and website. And to Bill Stein, who writes most of our copy for our award-winning quarterly newsletter and extended published pieces. And I would also like to recognize our board of directors. And so those of you that are in the room, I'd like you to stand up, please. Each of them brings to the table a rich knowledge of experiences with problem gambling, whether persons in recovery, treatment providers, gaming industry, or leaders in their own community. I continue to learn from their insights and rely on their feedback to keep us moving in the right direction. And so I'm really pleased to have their full support as we navigate these waters, so thank you. And so now, it gives me great pleasure to introduce our next distinguished speaker. Dr. Deborah Haskins is a recently retired counseling educator of over 25 years, receiving her Ph.D. in pastoral counseling from Loyola University, Maryland. And over the course of her career, Dr. Haskins is recognized for her leadership in the field of gambling disorder and acquired many credentials along the way, including being a licensed clinical professional counselor and supervisor. And she is also recognized by the International Gambling Counseling Certification Board as a Level 2 counselor, a clinical supervisor, and a trainer, as well as leading in the efforts to train spiritual and community leaders about gambling addiction. She's also the president of the Maryland Council of Problem Gambling, a very busy woman and very engaged. Dr. Haskins has trained mental health professionals in the U.S. and abroad to understand gambling disorder and provide culturally relevant services. Her expertise and publications include work with gambling disorder, cultural competency, and social justice attuned to mental health or wellness. One of the many accolades she has received is in 2021, Deborah was awarded the National Council on Problem Gambling's Monsignor Joseph Dunn's Lifetime Award for Advocacy. In addition, she serves on the Board of Ordained Ministry and the Association for Spiritual, Ethical, and Religious Values in Counseling. And her current efforts include developing online professional development and community wellness programs by equipping spiritual communities with the ability to support those with gambling disorder. She also does work including advocacy and training for those who have experienced trauma associated with a homicidal loss. I have come to know and respect Dr. Haskins' advocacy efforts and as a leader in the movement to be inclusive of diverse cultures in all aspects of our gambling addiction work, from staffing, board composition, training new counselors, inviting community stakeholders to the table, and supporting efforts to develop and accept culturally appropriate treatment. I think it's safe to say that Minnesota has more work to do when it comes to achieving racial and cultural equity in all aspects of the work that we do. But saying it and doing it are two very different positions. And so I've asked Dr. Haskins today to help us think about ways that each of us can bring to take action and contribute to positive change. We must be intentional about our commitments in equity and to ensure that the system supports best practices and cultural competency in treatment and prevention for all Minnesotans with addictions and mental health issues. Please join me in welcoming Dr. Deborah Haskins.
Thank you very much. Minnesota, good afternoon. So I want to thank Susan. I want to thank your board of directors, my esteemed colleague. It's an honor. Evian, Brian, all that were working behind the scenes. I really commend you for the amazing conference that you're providing today. And the fact that you're providing it online as well as in person is no rest for the weary. So cheers to you this afternoon, and hold on to your seats because we're going to go very quickly with some important learning. And I'm always very concerned as I present after lunch that I always tell my students and people who are in training that you're going to experience the carbo effect, the after lunch effect, where you are going to be fighting to stay awake. And so I hope that I'm going to provide you something that will help you be inspired and stay awake. So the title, as you can see, is How Can We Move Forward with Cultural Humility and Diversity, Equity, and Inclusion absent a strategic plan? What's your navigation system? And in thinking about the theme that you're focusing on, connecting, reflecting, and moving forward, it makes sense to be thinking about, do you actually have a plan where you're operating, where you're providing support to communities across the state of Minnesota? And hopefully I'm going to provide you some new opportunities to reimagine it. So our objectives this afternoon, number one, to identify and review very briefly key cultural humility and diversity, equity, and inclusion considerations for gambling treatment and prevention. But we're also going to be able to apply this as we think about substance abuse, opiate abuse, and other co-occurring mental health issues. The second objective is to identify and review components of what is considered to be an effective diversity, equity, and inclusion strategic plan. And then lastly, to encourage you as participants to really make one commitment, just one commitment to make one step towards the development of a diversity, equity, and inclusion strategic plan. Because when we talk about strategic plans, we oftentimes think boring. I would be one of those persons to say, I'm not signing up for a workshop on strategic planning. If I'm going to choose what I'm going to feel inspired by, that's not probably likely a session that I would actually be trying to take. And this is the content that we don't get taught in our professional life. We don't get taught in our graduate training programs and our undergrad training. However you got trained, if you're in peer recovery, you might not be thinking about strategic planning because you're doing everything you can to recover as well as help your communities that you're part of recover. And so this is the area that typically falls by the wayside. And so we're going to take a quick poll, and I'm going to ask you to respond yes or no to the following questions. All right. If you are online, you're going to see the poll show up. If you are in person, I'm going to just ask you to, with a show of hands, yes, do you have, number one, do you have a diversity, equity, and inclusion, we refer to as DEI, strategic plan at your organization? Raise your hands if you have one. I'm going to raise my hand because we have one with the Maryland Council on Problem Gambling. So, all right. And if you don't have one, if you raise your hand, no judgment. If there's no plan, raise your hand. No. Okay, we can probably say just from the ones who didn't answer yes, the answer might be no, but there's always some in between. Some of you might say, well, I'm not quite sure. And we don't really have an option for that on online. Yes or no? All right. How about the second question? Do you understand how to develop a diversity, equity, and inclusion strategic plan? If you can raise your hand, yes, if you know how to develop. And I'm going to ask if Brian is going to show us what the poll is. So it's helpful for me. I wear glasses and I have bifocals and I have astigma. So it's a little challenging for me to really get a view as well. And so Brian, feel free to type into the chat or someone can type into the chat what you notice. And so we're going to ask if the chat is there a way for that to be shown for question number 1? I'm not sure if it will, because we're doing hybrid.
Sure thing, Deborah. I can let you know that on the first question, do you have a diversity, equity, and inclusion strategic plan? We had 17 people vote and 29% said yes, 71% said no.
Okay.
And on the second one, do you understand how? 16 people have answered so far. 13% said yes, with 88% saying no.
Okay. Thank you, Brian. So that's probably in sync, even though my vision isn't the best. That probably is going to be parallel what you notice in the room. Because when we talk about diversity, equity, and inclusion, it's no surprise that the majority of us have never been exposed in our organizations to a diversity, equity, and inclusion plan. And the second one is, if we even have a plan, depending on when we started at the organization, most of us have not had any training or any kind of education on how to develop a plan. So I'm actually going to go pretty quickly through, I'm saying quickly because we're only together for about an hour and 10 minutes, but you're going to learn the components of a plan. And my hope in the Minnesota folks, the hope is that you're going to go back to your organizations, whether you're a private practitioner, whether you are in a community mental health agency that is providing gambling treatment and other co-occurring mental health and substance abuse treatment. The goal is, however you're functioning, whether you're in the gaming industry, whether you are in, if you are a leader, a board leader, the goal is that each of us will make a commitment to diversity, equity, and inclusion and actually start the process of invigorating such a plan. All right. And so I'm going to just get started with what do we mean by that? So let's start with the problem. I'm a science scholar, practitioner, and in science, many of you have learned in science, or if you're talking about working as a consultant, as I do, we always want to start with what's the problem, okay? And this is the problem. When we ask gambling disorders and gaming professionals to support community wellness, oftentimes we're asking them to do the support, but they don't have a strategic plan. So they oftentimes don't really understand how to actually implement a community wellness plan, because they don't really necessarily understand how to go about doing that. And that includes developing a culturally relevant plan for treatment as well as prevention. So, for example, in the state of Maryland, when we opened up our first casinos, we started an important prevention campaign. And that particular campaign recognized that in our state, the number one group that's at risk, which is probably similar to what you're going to see in Minnesota and other places, tends to be people of color. And specifically, one of the dominant groups is African American groups or African descent groups. And so we started a campaign strategically focusing before the casino actually opened to educate African Americans. And so that plan that we created was a strategic plan that infused cultural diversity, equity, and inclusion right from the start until the finish, okay? So that's one of the problems, that we oftentimes are asking people to support community wellness, but there's oftentimes a lack of a strategic plan. The second problem is that there's a lack of consistent, engaged cultural diversity, what I believe and say, or diversity, equity, and inclusion policies, procedures, as well as programming. And so oftentimes we haven't really updated our mission, our vision, our service delivery that is inclusive. Okay? A lot of times we may have hired diverse persons to work in our agencies, or we may appoint a person here or there that is a diverse person, typically starting with a racially diverse person or ethnically diverse person. Or we might, oftentimes, this is what we see, we will hold a program once a year, and the program is focused on diversity. And yet there's no consistency 365 days year round, 24/7. So it really doesn't lead to population effective change because we just have these isolated events that we're providing. And so that's the problem that we're faced with. And that's problem what you see. And so what do we want to do? We want to introduce what I refer to as a navigation system. And so the question is, I want to answer, what is a navigation system? Think about it when you are in your car. Just think about if you drive. How many of us think back to the old days? We didn't have the Wi-Fi, internet-based navigation system. You had to take out a map. Can you imagine that we actually did this back in the day? We actually drove trying to read maps. And how are you able to drive safely and with a map spread out? Can you imagine that? We would figure that out. And then when we advanced to actually having MapQuest, we would print it out, the directions. So you're driving with one hand and you're trying to get to your destination safely with a piece of paper with the directions. So now we actually have the benefit of a navigation system. What is a navigation system? I want you to think about this for diversity, equity, and inclusion and cultural humility. It's a system that provides a real-time map of what your current location is and gives you a step-by-step directions to a requested destination. So the goal with the diversity, equity, and inclusion plan is that we're going to create a step-by-step plan with a designation that we're aspiring to, and we're going to have concrete steps that help us get there. So the problem is that oftentimes our services focus on general communities, but also have a lack of cultural fit. So sometimes we're trying to get to this diversity, equity, and inclusion attuned service delivery, but it really doesn't fit. What we are offering doesn't fit with the communities that we're serving. So the navigation system is actually flawed because what we're using is incorrect or inaccurate or not really, connected to the communities. And then, as I said, oftentimes we lack a step-by-step process. So sometimes in our good attempts, we're doing our best, but we haven't done it in a strategic planning process way. All right. And so let's talk about what I refer to as a call to action. Why is this needed? Because how can we connect with communities that we have never even connected with? Think about that. I want you to reflect on this. This is part of your theme, connection. But how can we connect if from the outset, we've never connected with the communities? And a real simple, practical way is, have we ever actually walked a community? Have we ever driven through some of these communities? An example is when I was a consultant at one of the state psychiatric hospitals, and I supervised the psychologist interns for 12 months. They were there at the state hospital doing their 12-month internship. And so for the 12 months, I supervised them in diversity. And what I learned after the first year is that the majority of the patients were coming from Baltimore City. I'm from Baltimore City. This is where I live and work. And this is where I'm actually teaching at Haskins presently. Even after retiring, you think you retire, but you get recruited to do something else. So now I'm teaching in Baltimore City now, again, part-time as an adjunct. But what I found is that most of these patients were coming from Baltimore City, and I have a staff of new interns that really have never been in the city. And they are really disconnected from the patients or the clients. They don't understand who these people are because they've never had encounters with people that look like them, that talk like them. They don't understand their cultural values, beliefs, and behaviors. They have no connection. And so what I started to do is a drive around. After the first year, after we did our initial month intro, the second month we did a drive through Baltimore City, through all of the communities, from east to west, from north to south. We spent time so that they can actually visually get a a driving through tour and understand the nuances culturally about each of these communities that many of these patients are coming from. That's an example of connection. If we've never set foot in the communities, we can't really understand the community. If we've not talked to people in the communities, we can't really understand it. All right. So the other question is, are we reflecting, when we talk about reflecting your themes, the question is, are we reflecting on our own cultural humility and also implicit biases? Cultural humility is the word now. Cultural humility is the focus now versus cultural competency. And so what happened with cultural competency was there was this idea that you would get to an arrival point of competency. But the reality is that cultures are ever changing, are always dynamic, and there's no way that any of us will learn everything that we need to know to be in tune or effective with all cultural communities. That's just never going to happen. Even in our best attempts, we can always practice cultural humility, however, is the notion that we recognize I'm humble. I don't have all the answers. I can't know everything about this community member or this cultural group. What I can do is commit to lifelong learning and making a commitment to learning more about myself culturally, my limitations culturally. What are some of my implicit biases? Because implicit bias, by nature of the concept, says that at an unconscious level, all of us are implicitly biased and we're not actually aware of it. It works cognitively and unconsciously out of our awareness. And so once we start to take some of the implicit bias tests that each of you can even access through the Harvard Implicit Bias Test Project, you can take the test and then you can make a commitment to learning more about a particular area of diversity that you might hold some bias in, okay? And then the next question is, how can we move forward? Your theme of moving forward, how can we move forward when we lack consistent efforts to adapt our treatment, our prevention, our advocacy efforts to the cultural needs of the communities that you're serving, the health equity needs that your communities need, as well as social justice needs, okay? And so the result to this great problem that we have is that oftentimes our efforts are ineffective, they're disconnected, as I stated, from community needs, and we tend to be working in our own silos. Also, feel free to type any questions that you have in the chat, and we will entertain questions as we move along, as well as we'll have an opportunity at the end as well. All right. And so this oftentimes is the result. And so what is a diversity equity? What is a diversity strategic plan? I'm going to introduce to you a resource that was actually developed by the Indiana University PUI, forget what PU stands for. We love acronyms, but this is through Indiana University, and Indiana University is one of the communities that I support as a consultant, and I've created a lot of gambling education for the Indiana University Problem Gambling Awareness Program that's part of their Prevention Insights. So they have an actual diversity planning resource guide. This is available for you. You can Google this. You can get access to this so that you can start to use this in your places where you're functioning. And so what is this defined? This is defined as an intentional document that places diversity as central. What do we mean by diversity strategic plan? We're talking about a variety of elements, such as the definition of diversity would be included. What's the rationale that we're using to include diversity, equity, and inclusion? What is the process that we're going to use? In this planful process, it's going to identify what our goals are going to be. What are our strategies? What are we going to do in terms of engaging responsible parties, or what we refer to as community stakeholders, educators, politicians, people in recovery, nonprofits, et cetera, attorneys, public health professionals and advocates, also the medical profession, et cetera, veterans, military, everybody and anybody, okay, who is part of the world, we can include them as responsible parties. It would also include a timeline for implementation. I'll speak about that as well as accountability metrics, like how are we going to actually evaluate this DEI plan. So all of this is part of this diversity planning resource that you all can refer to. I've included the definition ahead of time. I talked about cultural humility, so I'm just going to skip through that. But I want to also just give you a quick primer. What are we talking about in terms of diversity, equity, inclusion? Because I don't want to just assume that everybody knows what we're talking about. I think that most people could define what we mean by diversity. But in case you forgot, diversity is a commitment that recognizes that all of us, regardless of our race, our ethnicity, our disability status, our ability status, our sexual orientation or sexual identity, whether we are LGBTQ on the spectrum, non-heterosexual, whether we practice a religious faith or spiritual identification or identity or indigenous healing, whether we are veteran status, it varies. I mean, there's so many ways of looking at diversity. And most of us are doing good work in terms of diversity. But I want you to reflect on this. Could you do better? So these are some guiding questions that you can take back to your agencies, to your practices, and to your workplaces. Think about the diversity of where you're functioning. What is it like? What comes to mind? Type into the chat if you would like. How would your reflection change if you were of a different race, sex, sexual orientation, etc., than your own? A lot of times, because we're working in our own cultural filter, we're not actually thinking about anyone outside of it, okay? And so for me, I tell people when I see the world and I look through these glasses, I see culture. Why? Because I am a Black person in America. And because I am a Black person in America, I have always been treated as a visible racial person. If I were to stand up, you would not be able to, you can't see this, but if I were to stand up, I'm 6'3", 2.5 inches tall. So the first thing people respond to when they see me, number one, is my height, because you can't miss me. Number two is because they see that I'm a person of color. And they see I'm a woman. But because I'm a person of color, that oftentimes takes over before they even notice, they pay attention to that I'm also cisgender, that I might be a woman. They might assume that I'm cisgender. And we can't even make that assumption. Not everybody is identifying with the gender they identify with that was assigned to them at birth. So I want you to think about that. These are just some reflection questions. Now, when we talk about equity, and feel free to type into the chat. As I said, type into the chat. Equity is different from diversity, and this is where we're typically failing. Equity strives to make sure that everyone has access to the same opportunities. And so a commitment to equity involves recognizing that not everybody is born with the same advantages and assets. some people are born in the world with barriers and with limitations. And so this idea in the United States that you just need to pull up your bootstraps, what if you never had boots to pull up? What if you are in a situation that you experience material poverty or deep poverty, and you don't even have the bootstraps to pull up? And so equity recognizes that in order to be fair and just, we have to also provide some correction and address the imbalances to ensure that people actually receive what every human being in the world deserves to have. Every human being deserves to have safety. Every human being in the world deserves to be loved, to be respected, to be provided opportunities with affordable housing, with affordable, just employment, that they can make a livable wage. How realistic is it to expect that someone is going to come seek services from our agencies and practices when they don't make a livable wage and they have to take, say, 3 buses to get to a place, where they live in a rural part of Minnesota where they don't have access, or they don't even have the broadband that's accessible to get Wi-Fi. Not only that, they don't even have devices that they can do telehealth, okay? Which changed, of course, we started to provide more access during COVID. But what if you live in an area that you don't even have the broadband with? So I want you to think about some of the equity issues that you can examine for Minnesota, wherever you are. What are the different touch points? So think about this. Here's a question. Diversity and inclusion can also be measured as outcomes, like the staff is diverse, the environment is inclusive, but equity involves a process. Okay, I didn't want to skip over that. I almost skipped over it. So I want you to think about a process within your prevention unit, or if you're providing prevention and wellness, community wellness. I want you to think about what are the different touch points where individual decision making can shape that process. Like, is everybody involved? Are you involving consumers in your process to determine whether, your services are actually meeting their needs? What might some of your biases be that is showing up to shape the processes that you're using? You may think that the processes that you're using are actually equitable, but if you're not including people from the different areas of Minnesota that you're supporting or want to support, then there can be limitations. And so the question is, what do you need to do to ensure that the process is actually equitable? So that's equity, all right? And then inclusion is referring to the extent to which people who are in your community or also at your agencies are actually valued in the community or in the agency. So a commitment to inclusion involves pursuing deliberate efforts to actually create and maintain an environment where everyone feels welcome, they feel respected, they feel supported to actually participate fully. And so an inclusive climate contributes to a person really feeling like I really belong here. So what happened in the field of diversity, equity, and diversity and equity is that we were focusing on diversity and equity, but people didn't feel like they belonged because we weren't including their voices. Okay, and so that's what we're trying to do better at when we talk about equity. And so these are some guiding questions. What words would you use to describe an inclusive environment? What practices or approaches might negatively impact how someone who has a marginalized or has an experience of marginalization or oppression actually feel welcome? So say I'm coming from a community where I'm a person of color and I'm in Minnesota, I am Black or brown, or I'm an immigrant or a refugee, or I've escaped my country because of political trauma or political war or oppression. How will I feel welcome in this experience that you all are trying to provide? All right. So how would you respond to this question if someone asked you, I know that working in problem gambling treatment or prevention can be challenging for a person who has a marginalized identity. What efforts is your agency making to ensure that all persons feel included, that all the communities feel included? So these are just some questions that I invite you all to continue to reflect on, and we'll continue on to what are some of the components with a strategic plan. Okay, so now I'm going to introduce to you two different types of strategic plans. Because unfortunately, if you look in the literature and you look at diversity, equity, inclusion plans and behavioral health, you're not going to see anything. I didn't find anything. And I'm going to talk about this point shortly. All right. So IUPUI developed a centralized diversity plan with a 5-year implementation timeline, 2016 to 2021. So I'll have to look back and see how did they evolve? Like when they measured their plan, did they have good outcomes? And so most times when you develop a strategic plan, you're talking about a 3 to 5 year process. And so they basically were talking about the university working on diversity, equity, inclusion throughout the university. So Smith in 2015 stated that this diversity, equity, inclusion framework for universities, and I'm basically inviting us to consider adopting this plan and making it connect to the agency work that you're doing, the community work that you're doing, your gambling treatment work, your prevention work, your community wellness work. You can take this framework and kind of modify it somewhat to still deliver what makes sense in your service delivery. So the question is, which framework can be helpful? I'm going to go over some of these components, okay? All right, let's see if we can get this to go forward. All right, but first, before I go through the plan, I want to talk about what are some of the barriers, all right? So one of the barriers you're going to see, I don't know why. Let me move this chat thing, hold on. Brian, if you can help me, I'm trying to move. Okay, here we go. Let me get this out of the way. All right, can you all see this well?
We can.
Okay, great. All right, so this is a visual of a barrier. So when we talk about barriers, what are some of the barriers? Before you actually going to implement a plan, you got to look at what barriers you have. Okay, what are you operating with? And then these are some. First of all, I've already spoken to this. One barrier is that we don't have an existing plan. The second barrier is that, when I looked at my state, and I want to ask you to think about Minnesota, there's no strategic plan that's providing a plan, say, for behavioral health, if you're looking at behavioral health. And then also, as I said, one of the barriers that we often see is that it's a one-time initiative. The other barrier is that there's an absence of transformative leadership. So if there isn't someone leading from the top that's committed to diversity, equity, and inclusion, then oftentimes that filters down to all the other levels. So vertically, horizontally, east to west, et cetera. And so the other challenge we see is that oftentimes you have one person who's committed to diversity, equity, inclusion, but you don't have anybody else. And so obviously that's going to really limit us, right? All right. So that's one of the challenges. So these are some of the considerations. Also, lack of leadership on cultural competency or cultural humility, you want to add. Lack of prioritization of cultural competency and cultural humility. We also need to conduct a landscape assessment. So take a look at your environment and see what are you doing, what are you not doing, and whether or not you are also including stakeholders, as I mentioned. The other big consideration is that we oftentimes don't have any budget allocated to doing diversity, equity, and inclusion. And so to do it well, it means that we've got to prioritize it in the budget and actually identify some funding resources that will provide support for the implementation of this. And then it can also mean that one other challenge that we see is that we can lack people, material resources as well as personnel resources. So a lot of times, I'm going to circle back to that issue. So I want to introduce this case study for a quick example. This was a case study that was done in a British setting, 2011. One British study found that clinical staff had engaged in culturally competent activities. What they found was a growing awareness of competency among the staff in general, and that many had attended training, but there was no strategic plan and procedures that actually promoted cultural competency. Okay. And so even though people were training, they really didn't have strategic plans and procedures to promote cultural competency, or what we're asking people to shift more to, cultural humility. And that it wasn't even really communicated well to frontline staff. And there was little understanding at the corporate level of culturally competent clinical practices, or cultural humility is what we're saying now, because in 2011, we weren't talking about cultural humility. So what was the result? That more work is needed to actually embed cultural competency and cultural humility and diversity, equity, and inclusion principles and practices at all levels of the organization. And that also means we have to introduce monitoring systems to enable the organization to actually know what we're doing in this given time, when we're going to evaluate the effect of that. Did it go well? Is it not going well? If it's not going well, then we need to go back to the drawing board. Let's reflect on what were some of the challenges that might have impacted, why things didn't go as effective as what we hypothesized or envisioned, et cetera, et cetera. You're going to see this in the upcoming slides as well. So what we want to also mention is the context. In order to understand diversity, equity, and inclusion and cultural humility, and be able to craft a good plan, we also have to understand context. And what do the numbers tell us? I say that if you look, and you have learned, probably many of you know the statistic, 1 to 3% of the general population has disordered gambling or high-risk gambling, okay? Or, what we refer to as disordered gambling, or if we want to use less stigmatizing, high-risk gambling, 1 to 3%. But yet less than 5% actually access treatment. And so we are really struggling. Why is it that we're not accessing, people aren't accessing what we're providing more? And I say this is my quote. You can quote Dr. Deborah Haskins, because people are doing group therapy in their own communities. What do I mean by that? They feel that the services that we're providing them don't speak to their heart, don't speak to their people, to their community, doesn't include their voices, their values, their beliefs, their experiences. So I had a former student yesterday visit my class at Haskins, and she was presenting on her research as a quantitative psychologist. And what she talked about was research looking at African-American children, and it's a longitudinal study. And she was talking about the whole point that we use these deficit models when we talk about intelligence, and we compare intelligence to the norm group, which is the European descent group. So she said, instead, what we want to do is we're using asset methodology. That's what we're talking about. We want to focus on how do we access and use at the center the strengths that people have. People are not going to come to anything if they see gambling disorder as the brand. If we are branding it as gambling disorder, and they are members of an already community that has been defined as disordered according to this dominant culture, and the science has defined them as disordered and as pathology, they're not going to access our services. So we have to change the language. We have to change our branding. We have to change how we relate to the community. Because guess what? People are going to stay in their own communities doing their own form of group therapy. And why did they do that? Because they feel that these are the people that understand them the most, people who know them, that they trust, that they can trust their heart, their spirits, their minds to. Okay? And so I want to now invite us to look at what are the components then of the strategic plan, because what we're seeing is that in all our efforts, we have no change. We have more knowledge yet, but we still don't have people accessing treatment. And so I love this story, this book. You all might remember this, A Whole Nother Story by Dr. Cuthbert. The numbers don't tell the whole story because many culturally diverse persons, families, and communities don't even participate in research because they don't trust the research, because the research is not done well by them, okay? So then now I want to talk about the components of a strategic plan. And this is what we didn't learn in professional training, all right? So first of all, the first step is you've got to develop a planning team, right? Think about it. I'm a sports fan. We got big sports betting going on, we know. Big challenges we're facing. I'm not sure I didn't look, I usually look things up, but I didn't look up where you all are in terms of sports betting, but around the globe it's coming fast and furious. I'm a big sports fan. I love sports. I'm a Boston Celtics fan. I'm also, my niece is a 3-time WNBA champion, Deborah Peters from Minnesota Lynx. So Minnesota, I have a love for how you care for my niece, Deborah Peters, when she was playing in the WNBA, 2012 through, 4 years as a rookie contract. And Lindsay Whalen is one of my favorite players. So I'm a big, and I love Kevin Garnett, Timberwolves to the, you all know the story. All right. Anyway, but if I think about sports, nobody wins a game by one person. Kobe Bryant didn't win all those champions by himself. Okay. Jason Tatum is one of my favorite players on the Boston Celtics. He's not going to win the game by himself. All right. Or Carl Towns. He's not going to win by himself. It takes a team. You've got to appoint a team and have a planning team that's going to come together to place at the center what is the agency need going to do and what are the community needs. And you want to identify people who are good problem solvers that can think outside the box. And you want to also include community stakeholders. And this is why we refer to this as an emic versus an etic sort of perspective. What do we mean by etic? Etic is this idea that we have universal behaviors that are expected, which is really focused on Eurocentricism, Europeans being the more dominant group, having more dominant privilege in the world, and that they became the norm group that everything gets measured against. All right. So that if you didn't exhibit these behaviors, then you didn't have good intelligence, et cetera, et cetera. So emic perspective, etic focuses on what's the universal behaviors. Etic is a cultural perspective. Etic takes people from the community, talk to the people, learning their values, beliefs, their experiences. What are your needs as a community? And then develops the event, the initiative, the campaign, okay, from bottom up, using the voices of the community, a diverse group of stakeholders, community members, everybody comes to the table to provide some input. Okay, and these individuals would make up an implementation team. This is the best way to do diversity, equity, and inclusion. to first appoint a team. In the same way that we're trying to get our agencies to become trauma-informed care focused, where you have a trauma-informed care planning committee or team that will work to now embed trauma-informed care at the core to make sure everything from bottom up, from east to west, from north to south, is trauma-informed care. And so, these are just some of the questions that the planning team would be engaging in. What is your perception of how the agency is doing in this area? How is the agency doing in terms of serving LGBTQ spectrum community members and consumers? As one of my trained clergy and faith leader through the Maryland Council asked us at an end of a training, she says, what is the problem gambling field doing to support LGBTQ plus persons who have gambling issues? And I didn't have a good answer to it. The answer was, we're not doing well at all. What are we doing to help people who are experiencing deafness? All right. That was another question she was asking, because she supports people who are deaf and hard of hearing. And so you want to spend some time really doing self-assessment, okay? That's a key part. So these are the other components. Now, this is the AMC toolkit as well. So I'm introducing another toolkit for you. Actually, there are three here. The Indiana toolkit, I said two, but there's actually three. The second one is the AAMC. And I forget what I think this comes from the medical folks. They basically summarize what I'm saying. You have a getting started, you do an environmental scan or a landscape scan. You then do a SWOT analysis where you're looking at strengths, weaknesses, what are the opportunities, and what's the timeline. So for example, when I worked with the country of Bermuda with NCPG, Keith White, when we started working with Bermuda before they started to open their first gambling, legalized gambling in 2017, we worked with them to do a SWOT analysis. And at the outcome of that SWOT analysis, what we decided to do, because Bermuda is a very religious country, they have 100 churches in a 20-mile radius. What we realized is, as a strategic plan, we had to start training the faith and spiritual leaders and indigenous healers first, before we train the clinical folks, because in that context, that was where people were going to go to first. All right. We would also need to develop new vision and mission statement and strategic goals. So when the Maryland Council on Problem Gambling, when we did our strategic plan, if you go to marylandcouncilproblemgambling.org, you're going to see what our strategic plan is, and you'll see that we identify what our core values are, what is our commitment to social justice. We embedded all of that at the core of everything we do. And then we identified what were going to be some important objectives, how are we going to measure that, what we wanted to create as an implementation plan within the first year, the first 3 years. And we actually worked with a business coach to help guide that whole reflection process and help us make deliberate decisions that make sense for what we had, some limitations and financial resource challenges. So we weren't able to do everything. All right. So you can think about using a similar process like this AAMC plan, because it's very easy to understand and it will take you through. All right. And then what I've done is I've also introduced the University of Berkeley strategic plan, and you have the links here, but it will give you all the components. So in short, what I'm offering you is the different components, whether you use the Berkeley plan, whether you use the American Association of Medical Professions, all of them are the same. You're basically creating a strategic process using a planning committee, and you're going to spend a lot of time, usually initially, in reflection. And then you start to work towards really identifying vision statements, goals, strategic initiatives. And then you can implement, as you see here, how you're going to adopt it, when, where, how, etc. And so the process of value clarification in the strategic planning process, I would say, is the most important part, because value clarification, as you imagine with gamblers, when we're doing work with gamblers and people who are accessing our services, we're coming in for prevention opportunities. What you'll see is that you really have to spend more time, engage in reflection. So let me just show you this, the Maryland Council, just so you can see. I don't think, I'm sorry, Brian, I know you probably told me I should have had this up, so I'm not going to be able to show you all. But if you go to it, you would see the actual vision statements, the mission statements. I included here, but I'm not going to be able to link to this. I apologize for that. Okay. So like I said, one of the most time-consuming process is really the hardest work, is to say, who are we? Who do I want to be? Who are we trying to become? How are we trying to show up in the communities that we're saying we want to make greater commitment to? The next step before you conclude is that you've really got to identify what we refer to as key performance indicators. We sometimes refer to these as benchmarks. And what are these? These are going to be the ways that we actually measure how effective our attempts are. And so this is where we quantify it. You might say, okay, what we want to do is, for example, this year, the Maryland Council on Problem Gambling, we are focusing in the next couple of years of focusing on Latina, Latino, Latini, Hispanic, Latinx. I say all of that because not everyone is identifying with this gender neutral term of Latinx. And so you've got to be careful how you are identifying the community. When you're talking about the Spanish community, it's not going to be always the Latinx community. They may identify specifically within their community, Mexican or El Salvadorian or Guatemalan, or they may be a combination of Afro-Caribbean and Spanish. And so we decided that we were going to do better. And the first step was to invite a clinician who is in that community, that's doing great work in that community. She didn't have time to be on our board, but we now have Friends of the Board, which is named after Joanna Franklin Roberson, my mentor, who was one of our leading leaders in the gambling field, problem gambling and gambling disorder field. She was the former president of the Maryland Council of Problem Gambling, amazing trailblazer. We love her and we miss her. She passed away in 2013. And so we now have Friends of the Council, and this is something you might want to think about. There are community stakeholders that don't have time to make a full commitment, say, to be on your team or to be on your board, but they will help you in a specific area that they are passionate about. And so what Marilyn is doing is Mary Lynn, L-I-N, Marquez Beckley, is helping us with the Spanish outreach, Spanish community outreach. And one other example is I asked Marilyn, with the National Council on Problem Gambling, we did an anchor webinar series on trauma. And so we have an anchor webinar that I did on COVID trauma. We had one on Native and Indigenous people's trauma. Dr. Tim Fong is going to focus on Asian descent community and trauma. Marilyn Marquez Beckley is going to she created one in Spanish on substance abuse, problem gambling, and trauma in their community. And it's going to be both in English and in Spanish. And it's also going to provide a PowerPoint for in English so that if you're presenting or you're providing this to your communities, the Spanish, you have the English outline to know what it is that they're saying, she's talking about, okay? That's going to be provided to the Minnesota, your affiliate, through Susan Tucker, your affiliate here that's sponsoring the conference and all the great work that you all are doing there through your affiliate. And so this is a way that you can expand how you're showing up in the community, because the reality is that you may be limited. So that brings me to this question. What if I don't have organizational buy-in? Then my response to that is then develop your own strategic diversity plan in the way that you can affect change, and then provide maybe just a pilot to show for the organization to see what is the outcome of that, which generally speaking is always going to be positive, and then start with that and then expand. So you may need to start small and make the case for expanding once you have some pilot information. All right. So I want to show you another example for another case. It's a little bit different from problem gambling, but it also includes substance abuse and problem gambling. I want to show you. Because I do a lot of work with the faith and spiritual communities. And so one of my questions is, as they're trying to improve and enhance community wellness, I'm thinking, how can they enhance it if that's not their scope of practice? How can we expect clergy, faith leaders, spiritual leaders, indigenous healers, people who are doing holistic health and public health in their communities, if they don't have the knowledge and awareness and the tools to really implement it? And so what I believe one of the recommendations is to partner. And so that's going to take me to this next one. We did one on the youth, what I did with the Baltimore, Washington United Methodist Church, which I'm United Methodist by faith. And so I do a lot of work with my denomination, but I do work with cross faith. And so I'm just going to click on this. I'm actually going to stop share this because I actually have this open and I want to show you all this. Or Brian, I think I had it. I think this is it, right?
Yes, you all want to share the website now.
Yeah, I think this is it. Okay, so let's see if you guys can see this. All right. Can you guys see this?
We can. Perfect.
Great. So this is an example of, like, again, when you develop a strategic plan. I developed a strategic plan that focused on mental health wellness and public health wellness for the faith, this particular faith community, that's focused on congregational health and community health. And this was a 12-month strategic approach to improve well-being. And so what we did was, I had one of my former students who's a clinician. We divided the work. We developed this public health strategy that gives them, there's a public health topic we know already for every month. And it gives them ministry ideas, and then gave them links to fact sheets, infographics, media showings. We gave them social media language that they could use to do social media posts. They don't even have to create it. It's already here. And so we have like a monthly plan. Okay, here's January. January is Mental Health Wellness Month already. And then it gives them, what are some ideas that you can use to implement wellness in your community? For March, Problem Gambling Awareness Month, and I think every day is problem gambling awareness. We don't want to limit this to March, obviously, but we know that March is Problem Gambling Awareness Month, right? All right. And so these are some ideas. We already have a toolkit through the National Council on Problem Gambling. We have the Joy documentary. We have the Glenn story, Gambling in the Military. And then we have a whole toolkit that NCPG provides every year that also includes social media messaging. And then there's more things that you can do. And then we show like substance abuse, awareness, drug abuse. May is drug trafficking, International Drug Trafficking Awareness Month, for example. I mean, there's lots of things that you can do. But again, if people don't have the tools, they don't have the ability to implement a lot of what we're asking them to do. All right. And so this was just another example I wanted to share with you guys. All right. Let me see if we have anybody with questions in the chat. Let's see if you have any live questions or any questions in the chat. I don't see anything so far. All right.
We don't
I don't
have
think
questions right now.
Do we have anybody with any questions?
No.
Okay, no questions? Okay. So again, I want to just say a couple of things again about what if you don't have the buy-in. I mean, of course, it's not as effective if we have to work as a lone ranger on problem gambling, wellness and community wellness and diversity, equity, and inclusion efforts to expand wellness across diverse communities, whether they are racially diverse, ethnically diverse, income level diverse, whether they are LGBTQ, queer, plus on the spectrum, gender, diverse, whatever it is, okay? Material, whether they're living in hard poverty, whether they are middle to high income diverse, whatever it is. If we don't have organizational buy-in, we know that's going to be hard. But the reality is that you may have to start just where you are and get started. So I had one of my former students, Rosalind Caesar, who is trained in gambling, problem gambling, disordered gambling, high-risk gambling, and this is a clinical director who works at an agency in a part of Maryland that's in one of the suburbs. And in her particular area where she provides services, they are providing services to a largely African American, African descent consumer population, as well as Spanish speaking consumers. And so Rosalind contacted me and needed help how to move the agency forward because they were seeing that they were not getting as many community members accessing their services, even though probably 60 to 70% of the community is African descent, African American, and Spanish speaking, and so I have asked Rosalind to share in this audio sharing what she was able to do and to share some of her own reflections on how she focused on including diversity, equity, and inclusion with Laurel Helping Hands. Okay.
In both of my jobs, I provide individual and family
Can you hear?
to youth, adults, and
We
families.
can.
But also, as a clinical director, I do administrative and supervisory roles. I'd like to thank Dr. Haskins for inviting me to share my experiences with you today. So to start, I would say that if you reflect back to grad school, we were taught that as clinicians, we should learn about our clients' cultures because it helps us understand them so we can help them better. But I think that people should learn about other cultures anyway in order to develop an appreciation for other ways of being in the world besides their own or besides what they are familiar with. It makes for a better human being, and a better human being is a better clinician. As you can tell from my accent, I did not grow up in the US. I grew up in the capital of Ghana, a country that has at least 15 major languages, each language with various dialects, and they all come with their different cultures, nuances in cultures. So I was surrounded by cultural differences growing up. So for me, living was being multicultural because on a day-to-day basis, I interacted in different languages and in different cultures. And so that background shapes how I think about multiculturalism as a clinician. In my view, multicultural competence and multicultural humility is one, acknowledging that I live in the world with other people, and two, that I need to know them because we are part of the same ecosystem, and so we have to get along. And we cannot do that if we do not know each other. So it does not matter whether I am a clinician or not. That is how I approach interaction with different cultures. In terms of my practice as a clinician, I think of multicultural competence not as a measure of knowledge, not as a set of steps to take or not take. I think of it as my willingness to engage and learn about other cultures. And cultural humility is the attitude I bring to that learning and engagement, because that kind of willingness stimulates my curiosity, and I want to know, and it makes allowance for being ignorant. I do not feel pressure to be the expert in a relationship, whether it is with my client or with somebody on the street. Individually, it means that I take action to engage with the culture, whether it is through reading about, living with, talking to people from other cultures, or as clinicians, we have that wonderful thing called CEUs. Being intentional about picking CEUs that can help you address some of this knowledge. At agency level, we can take actions like talking, having discussions, tough discussions about different cultures, our experiences, what we know, what we have learned, and bringing in experts to advise us, to speak to us. And very effective or important, what I see is hiring staff who are members of a culture or who speak the language of a culture. Of course, the last two are not always feasible because we have limited resources. Now, to give you an example of what has happened with me, at the time I was hired for my full-time position, I had already noticed that the population of Hispanics in the region was growing. You just had to stand by the street corner and you could tell. So my priority when I took the position was to learn Spanish and to have a Spanish-speaking counselor. Now, the area already has a large African-American population, and it was reflected in our clients. In my first year, we had mostly African-American, some Hispanic, very few Caucasians. In the next year, you could see the population of Hispanics in the number of Hispanics in our client sample growing. Okay. So when I was approved for 2 full-time counselors, I needed one to be African American and one to be Spanish speaking. Recently, we have noticed an increase in LGBTQ youth who are coming to us. We are having more youth coming with identity, sexual identity or gender identity issues. That means that this is a population that I need to start to understand. The agencies need to start to understand, to get to know, to engage on an individual level. I have started taking classes, taking CEUs. I talk to my clients.
Okay, I'm going to stop here just because of time. And you all will be able, I think there might just be like half a minute left, but I think you get the idea. Rosalind did the work to really be intentional about diversity, equity, and inclusion. And when she knew that she was limited, she brought in the outside resource to help the agency move along. And that included me working with the agency to change their mission, their vision statement. I asked them if they were providing any support on adverse childhood experiences and trauma, because these communities, most people, not just racialized communities, almost, if you look at the population and we look at the science with disordered gambling and high-risk gambling, we see a large percentage who have experience some type of childhood adversity and trauma, and the way that they self-medicate is through gambling and gaming. And so these are just some summary tips, and I feel like I've maybe moved into our QA time and cut that down. But just to summarize, the work is ongoing and continuous. We want to also recognize that evidence-based treatment and prevention has contributed, but there's limitations, as I said, because research doesn't include all voices. Also, no person is an island. Develop relationships and partner. And the key strategy is to build these relationships and collaborate as much as possible so that you can continue to do the best work to provide opportunities for people to breathe better across diverse communities, no matter what they look like, what language they speak, what language they don't speak, whatever it is. We want to be able to connect to help heal the world. And so these are just some resources that are available for you, some recommended readings, and feel free to email me. And you can also go to my website, and I have resources there as well. So let me stop here. And I want to apologize because I think I've run out of time and I've cut into some of the QA. But I know we got started a few minutes after. So let me just check in with the leaders here and see, because we have another presentation right behind this one.
I don't think we have any questions in the room, and I'm not sure what came in online, but I do want to say that the Minnesota Alliance on Problem Gambling will be undergoing a new strategic plan process in the next month or so, which will take us a few months. And so this has been very helpful. We will look at this, look at your resources, and see how we can incorporate that into our overall plan as an organization. So I really appreciate.
You're welcome. Yeah, there's nothing, quote unquote, this isn't one of those sexy workshops. Some of these workshops, you're going to be more intrigued. The strategic planning is not the one that people are really excited about. But when you get excited about diversity, equity, and inclusion. And that's what you can get excited about and let that drive you. So thank you to the Minnesota Alliance. I really want to commend you that you're committing to the strategic planning process and getting started. And I'm sure you're going to grow from there. So let me know if it's any way I can be helpful. And I wish you all well. Stay well.
Thanks, Deborah. You too. We really
Thank you.
Thank you.
You're welcome. Bye-bye. And thanks to you, Brian, as well, and Ebion.